Hi, and welcome back. You're listening to the Perio Patient Podcast, a podcast for my patients and anyone else who cares to listen. My name is Dr. Ben, or Benjamin Young, and I am a periodontist in private practice in San Antonio, Texas. This is episode 103, and the title is Avoiding Overtreatment. Recently, I got a call from one of my daughters. She lives in another state, and she had a dental question. She had been to her general dentist, a new person to her, and she was advised that she had some stains in grooves of her molars, maybe bicuspids, I'm not clear, wasn't clear, a number of teeth. She had stains. She was told that she does not have any decay, no little early signs of decay. Later on in the conversation, she told me that the way that it was presented to her was through video cameras. An intraoral camera was used, a little wand, that then was used to project the picture of the tooth and the grooves onto a wide screen, so that they could talk about it and see it. I think this is great technology. I have no problem with it. I use cameras myself. It helps. Pictures are worth 1,000 words. But the treatment recommendation was, well, to prevent the possibility of decay, we need to clean out these stains in the grooves and then seal them, maybe with a composite material, some white material. So she asked me, Dad, what do you think? Do you think that's necessary? So I'll pause a moment and let you think about it. What would you do? How do you go with this? Of course, she had the advantage of having a dad who's a dentist, but I'm going to tell her what I think is true. Actually, what I want to say is that she'd already figured out for herself what she thought made most sense. And I would say to you, anyone listening here, figure it out yourself and do what you believe makes the most sense. The cost on this was going to be significant, and what would be the advantage? Now, what I had said to her was, under these circumstances, the fact that she's in her 40s, these teeth have been there a long time with these stains. What's going to make a difference if you remove the stains now? Why would you do that? Secondly, isn't there a possibility that as you do this, you're going to open up enamel and possibly open things for decay? Or aren't you starting down the road of now requiring over time, as these quote-unquote fillings, coverings fall off, isn't it possible that food could get caught on an edge of a filling, and so now we're replacing the fillings, and maybe now we have decay that we didn't have before? This all also increases the risks of increased sensitivity of teeth. You're working on them and you're opening up enamel. So my recommendation to her was, I wouldn't recommend you do it. I don't think you need to. So that's kind of the conclusion she had made. She just wanted to hear from another source, which I would also say to you who is listening to this, consider other sources. You don't have to take my word for something. If you've come to see me, get other input. And sometimes it is that you have friends who are dentists. Run things by others. I don't have a problem with that. I think bottom line is, even if somebody makes a mistake on something, I would think it's better to have as much information on the question that you can before you make a decision, so that you feel comfortable about it as you're moving through it. I think it improves patient care on that. Now, I want to also add that when we're talking about children and baby teeth, and maybe the permanent teeth as they're erupting into the mouth during childhood, sealants on these in this situation is an excellent idea. So I am pro sealants in children to prevent decay on teeth at their age, because it's a great way to hold back on problems when people are children. Later on, maybe they will need a filling. Now, in my daughter's case, what she was told, which I guess is the truth, there was no decay, just stains. So if there had been found decay, maybe something would need to be done. There are situations where decay is actually arrested. It's not going anywhere. It's static, which then brings the idea that if you have a trusted dentist that you will see over the years, oftentimes you will have less dental treatment than somebody who moves around from dentist to dentist. And this isn't, this has to do with the law, basically. If you come to me, well, let's pretend I'm a general dentist and you come to me as a new patient and you've seen other dentists. I'm obligated to tell you everything that could possibly go wrong. And so my recommendations may be that we need to fix things, because what I am lacking is the ability to look at this in long term. I'm seeing you as a snapshot. I'm seeing you as you present to me today. Now, there are times when you'll come to me as a periodontist, especially if you're new, maybe you've come from another state, you've been under periodontal care somewhere else. I will oftentimes hold back on making any active recommendations until I've gotten at least a couple of evaluations with maintenance. In other words, make some measurements, clean lightly, come back in 3 months, let's make some more measurements, and let's confirm what's going on here, and let me see you in the best light possible, and let's slowly bring you into what maybe needs to be done. But unless there's an emergency, oftentimes we can look at something over at least a little bit of time to make better decisions. So that often is the case. But I think that it's very true that people who move around a lot from dentist to dentist, and maybe they're doing it because insurance is shifting, oftentimes end up paying more. And not just in money, but paying more and getting more dental treatment than maybe they would have had they stayed with a dentist who was following things. Maybe they placed a filling and that filling is starting to look a little worn. Maybe there's some stain behind a composite, but it's not an aesthetic concern yet. We're looking at it, and they can forewarn that, well, maybe in a year we'll want to replace that. Gives people a heads up, a head start, to see when it might be useful to come back in and replace something. But replacing fillings at too fast a rate can wear out teeth too, and can affect the pulps. So it is the dentist's obligation to their patients to do the best they can to manage levels of care over periods of time. And when insurance and other things interfere and all of a sudden people are moving around, that makes that much more challenging, because you don't want to have a new patient and then they go somewhere else 6 months later and somebody says, well, you have decay in this and this. That's a problem. So everyone wants to find everything they can as a protection to make sure that the patients are aware of things. I hope I made this clear. I'm going to kind of just sum it up. Number one, if you're an adult and you've had these teeth a long time and somebody's now making recommendations to do a lot of work, get a second opinion. As for children and the eruption of teeth into the mouth, sealants are great. And so follow the recommendations of the pediatric dentists and the dentists who are taking care of children. And that's a great preventive step. So I'm all for that. I guess that's it. That's all I've got. You have been listening to the Perio Patient Podcast. I am still Dr. Ben Young. Thank you, as always, for listening. Bye for now. There was a person who sent 10 puns to friends with the hope that at least one of the puns would make them laugh. No pun intended.